As you probably know, for about a month, I served as the town manager after Angeline Ellison resigned, and I'm happy to tell you that we have an interim town manager. His name is Peter Heckenblickner. His name is Peter. Yeah. So Peter is a professional. He retired after 28 years of service as a town manager, and now he is doing it as a part-time thing. So he'll be here for the next 3 to 6 months, and I've had an opportunity to meet with him, and he's very experienced, and I think he'll be a very good fit here for the short time that he'll be here. During that 3 to 6 months, they expect to hire a new permanent town manager. So just to keep you up to date, that's what's going on. We have a guest speaker here today. Her name is Elisabeth Haddad, and she is from the office of the District Attorney, Joe Early. And District Attorney Early has asked her to come here and speak to you. She is the Community School and Outreach Coordinator, and she's going to be talking to you a little bit about prescription drug safety for seniors and perhaps some information about scams. She has set up a table at the back of the room with all of her documentation, and she asks that you please go through it and take some with you when you leave, okay? So without any further ado, Elisabeth Haddad.
Thank you so much.
Thank you. Okay, you can only go so far.
Let me see if I can get it right there. So, good morning, everybody, or good afternoon, I should say. Thank you, Chief, for having me, and Lisa for inviting me. We're very happy to be here. As the Chief said, I work for District Attorney Joe Early, so he's the Chief Law Enforcement in the county, and we prosecute all the criminal cases here in Worcester County. However, I am not an attorney. I work in his outreach and education program. And I just said to my friend Gene Daly there, this is the third chief that I've worked with on Lunch and Learn and come and done a talk out here at the Uxbridge Senior Center. So it's always great to be here. I do have a PowerPoint, and I realize it might be hard to see, but don't worry, it just helps me keep on track, and I'm going to tell you everything that's in there. So, as I said, Joe Early is the district attorney for Worcester County, or the Middle District. That's 60 cities and towns right here in the middle of Worcester, Massachusetts, from Winchendon to Blackstone, and from Southborough all the way out to Warren. So it's a big county. One of the things that's happening in our county, in our state, and of course in our country, is the opioid crisis. I'm sure everybody's either read a newspaper story, they've seen something on the news. You may even have experience with opioid addiction by someone close to you, or somebody that you know, or someone that you know of here in town. So unfortunately, opioid addiction has affected people from every socioeconomic level, every background, and Central Mass has not been spared. So in Central Massachusetts, we have had quite a few overdose fatalities, unfortunately, in the last few years, as well as we do have a high rate of addiction like most of Massachusetts. But the truth is, we have a lot of people here in the state and in the county and always locally that are working to help curb this terrible addiction problem. It's not going to happen overnight, but we've got lots of stuff that we're doing. So this is hard for people to see, but I'm going to give you just some statistics about the current opioid addiction epidemic and how it's impacting everybody in our country. For the third year in a row in the United States of America, life expectancy has gone down due to overdose fatalities. So that is a really big deal in our country, because our life expectancy has gone up steadily since the end of World War II. And suddenly now we are actually seeing life expectancy go down by about 0.001%, which doesn't sound like a lot, but it really is a huge deal. So that's one way it's impacting people. Overdose is the leading cause of death for people under 50 in America. In 2017, unintentional deaths, which include overdoses, became the third leading cause of death in our country after heart disease and cancer. It was much lower, and actually kidney disease was the third, but now it's the third leading cause of death. We've had more overdose deaths than gun deaths in our country, more overdose deaths than traffic deaths in our country now. Overdose deaths have greatly surpassed traffic accidents, if you can imagine that. So these are some very sobering statistics, and that's why really all of your government agencies, from the very top, from the federal government right down to your local officials, are trying to work on this problem. I'm not going to go into all of that. We did have a decrease in Massachusetts of about 4% of fatalities. Unfortunately, that wasn't reflected in the numbers here for Worcester County. I'm not going to go through all these charts. So I'm going to talk a little bit about what the district attorney's office is doing with all of our county partners to work on that, and then I'm going to talk a little bit about what folks can do themselves to help make an impact on the opioid overdose epidemic. That did not come out. So first of all, the DA does have an opioid task force. So the district attorney, his district is 60 cities and towns. So he has a very wide reach. And one of the things he's trying to do with his opioid task force is bring all people from all across the county working together to come up with some best practices and some of the best ideas. So we have 60 police departments. We have 53 school districts. We've got several hospital systems. So we're all trying to work together and bring people together to come up with best practices. So that way we find out the best ideas and we share them, and we don't have people all kind of working off on their own rather than pulling together. So that started in 2015. The district attorney early has now brought in over $1 million in federal and state grants for Worcester County to fight opioid addiction and to fight drug abuse. So that's just since 2015, so in the last 4 years. And we're always applying for grants. So you can have the best intentions and the best ideas in the world, but if you can't fund them, if you can't pay for them, then they don't work. So the district attorney has been very active in applying for grants. Since April 30th, I could update this, we have participated in 192 community opioid awareness events. We've done many more school events, we've done senior events, but just opioid events, almost 200 with over 20,000 people attending. The district attorney's office has conducted over 490 student drug and alcohol prevention presentations with over 55,000 students attending. So we are really working at a prevention and awareness level. That's probably the most important thing that we can do. These are some other things. We have information. We have a special display for parents that's a mock teenager's bedroom so that they might see what might be in their child's bedroom that could be indicative of drug use. We have some memorial walls. We work with people and their families that have overdosed. We've brought authors in. We've had movies in. And all of these things are to raise awareness and give parents and folks information on how to keep their kids safe. Because we know one thing about the opioid epidemic is that we can have all the treatment and all the grants to help people suffering from addiction, and we continue to do that. But if we really want to end this epidemic, then we really need to keep our youth from starting to use, from initiating and taking those drugs. And so that's why we have a huge push on prevention. The other thing is the DA worked with the Mass College of Pharmacy, our opioid task force did, and Walgreens, and we printed out cards that talk about prescription drug safety, and those are for everybody in the community. And I actually have some of those in the back, but we actually worked with a bunch of pharmacies, and we hand those out to people when they get an opioid prescription. And I'll talk a little bit about opioid prescription safety too, because there's a lot of information on those cards that's important for everybody to know. We also did some awareness on buses, billboards. We have drug courts. We have 5 drug courts here in Central Mass, including the Uxbridge District Court, which is right down the street. We worked with law enforcement, especially in the beginning of the task force. So I'm going to say this, this epidemic it didn't come out of nowhere, but all of a sudden it just seemed to kind of explode, if you remember. And suddenly we had all these fatalities. And our police and our first responders, they were the ones that were really doing the brunt of the work. They responded to all the calls. They did all the investigations. So when we first started getting grants, we really focused on helping law enforcement with materials, including Narcan, which is an opioid overdose reversal drug, and other stuff like that. And I have to commend all the police chiefs, here in Uxbridge and across the county for all the great work that they have done in really trying to help communities. One thing the DA will say all the time is we cannot arrest our way out of this problem. Addiction is a disease and it needs treatment. It does sometimes result in criminal behavior, and certainly traffickers are always prosecuted to the full extent of the law. But when possible, the DA always says, show compassion but stay within the letter of the law. And that's why we have drug courts. We want people to get better. We don't want to just put them in jail, because they don't get better. They just get out and they end up back in jail. And our police chiefs have been fantastic in working with their communities on a local level. One of the things we did work with the police chiefs a few years ago, and with the Mass Department of Public Health, was getting drug take-back boxes in all of the police lobbies. And I'm going to talk about that a little bit when we talk about what you can do. But those were really instrumental in helping folks take care of that. Interdiction efforts. So like I said, we cannot arrest our way out of this problem, but still we have to arrest traffickers. And every day, on a daily basis, local, state, and federal authorities are here working in Worcester County, doing investigations and making arrests. It's happening every single day. Some make the paper, some don't. At one time, it's hard to read, but in Northborough in 2017, the DEA, Northborough Police, State Police, a whole bunch of groups, they had an investigation, and they actually raided a storage facility that was the largest raid of fentanyl in the United States at that time. Unfortunately, there's been much larger arrests and raids since then, but that was the largest in the United States at that time. So we talk about opioids, and maybe we'll talk a little bit about that, because there are prescription drugs like Percodan and Vicodin and OxyContin and oxycodone. You hear about those, and those are opioids, right? They're prescription opioids. But heroin is also an opioid, and fentanyl, another drug, is also an opioid as well. They're almost all kind of the same thing. Some are synthetic and some are natural, but they all have the same effect on you, that they give you that euphoria. They are also all very physically addictive. The prescription drugs are just as addictive as heroin itself, or fentanyl. The difference is that with heroin, we had a heroin crisis for a while. After we had a prescription drug crisis, we had a lot of heroin overdoses, and then we had fentanyl added into our illicit drug supply. And once the fentanyl came in, that's when our overdoses really went through the roof, because fentanyl is a very, very, very strong opioid. So that's really where we are today. That's really how we got here. We started with a prescription drug crisis in the late 1990s that morphed into a heroin and then a fentanyl crisis. And I guess another case in Worcester. So there's a whole lot of ways that this opioid crisis and prescription drug crisis affects people. And one of the big impacts that it's having is on families. We have parents who are addicted to opioids that have small children. We have 38,000 grandparents in Massachusetts who are raising their grandchildren right now because their children have drug problems. In Worcester, there was an arrest, and when they went to execute the warrant, they went into the house. They found 100 grams of heroin, cash, scales, cutting agents, all kinds of stuff for drug dealing. But there were no adults there. So in a house with 100 grams of heroin, there were 3 children, ages 2, 5, and 10 alone. So this is the impact. It does not just impact the user. It impacts the family. It impacts everybody. And some of the ways they get it in, I guess that's another Worcester arrest that's kind of interesting. There was another warrant that was executed in Worcester. They found large quantities of marijuana and heroin, and when they went to execute the warrant at the woman's house, what they realized was she was not the dealer or anything like that. Someone that knew her, that knew that she was home and was receiving packages, got her to take all these packages into her house. So all these packages were coming from out of the country, and she was receiving them. But they did arrest the suspect, but she didn't even know what was in the boxes, and she was just receiving them. So opioid medications, prescription drugs, are actually drugs that can be used as an important part of somebody's medical health or somebody's health conditions. They are necessary for some conditions. If you have surgery, you may need opioids. There might be other reasons why a doctor would prescribe prescription opioids to you. But it's always important to understand that whether someone buys heroin on the street or you have a doctor that's prescribing opioids to you, large quantities, regular, either way, you can become addicted to those opioids. So it's important to be very, very careful and understand they have a high potential for abuse and addiction. And you also want to make sure you know how to store and dispose of them safely. Because part of the reason we ended up in an opioid addiction epidemic was because in the late 1990s, doctors began to prescribe lots and lots of opioids. They were told by the drug company and then also by, their own medical society that they needed to treat people's pain. So what they did is they started to prescribe large quantities of prescription medications. Some people became addicted to their own medications and continued to have an addiction problem and turned to heroin. But sometimes people would get all these pills. Sometimes people would have surgery. They'd leave the hospital with 120 pills. They'd take 5, then they'd put those other pills up in their medicine cabinet, and they'd say, you know what, I'm going to hold on to these because, gee, what if I sprained my ankle next week? I wouldn't have to go to the hospital. I'd have those. I paid for them, right? I paid my copay. I don't want to just throw medication away. And so we had a lot of prescription drugs in people's medicine cabinets, and those started to get abused as well, particularly among youth. And I have a statistic about that. So it's really important to understand the high potential of abuse of these medications and how we got here. So there's two classes of drugs right now that seniors can get prescriptions for fairly easily. So doctors have definitely cut back on prescribing these drugs, but definitely our senior population gets more prescriptions than a lot of the rest of the population. So when you're getting prescriptions, you definitely want to ask your doctor about it, right? But also there's two groups. One group with a high potential for abuse and addiction is opioids. Percodan, Vicodin, codeine, or you might have hydrocodone, oxycodone, OxyContin, all of those names. Those are opioids. They have a high rate of abuse. The other type of drugs that have a high rate of abuse are benzodiazepines, and those can be anti-anxiety drugs. Sometimes you might get a prescription if you're having trouble sleeping. They might want to give those to you briefly, although there's better medications for that. And those are things like Xanax, Ativan, Valium. We see a lot of prescription drug abuse, not just with opioids, but also with benzodiazepines. As I said before, and we're going to talk a little bit about this, and I have a handout up front that looks like this right here, and it's got a lot of information on prescription drugs. One of the reasons we wanted to get this information out was because people sometimes think that if I'm taking these prescriptions from my doctor, well, then I can't overdose. It's medicine from my doctor. The only people that are going to have an overdose are people that are using it the wrong way. But the truth is, with prescription opioids, anybody can overdose. They always have a high potential for overdose, whether they're prescribed or whether you've bought them from someone on the street. So that's why we want to make sure that people understand it's important to use them safely. Take one of these cards. It's got a lot of information on it. So the other thing with prescription opioids, and then we talk about benzodiazepines, Xanax, Valium, Ativan, and those drugs, and alcohol, is all three of them work to depress your central nervous system. So what happens is many times people accidentally overdose because they're taking opioids, and what they don't realize is that they should not be drinking alcohol and they should not be taking things like Ativan at the same time. So one has a possibility for overdose, right? And then 2 is kind of a double whammy, and if you add 3, it can be a triple whammy. So when your doctor's prescribing medications, you want to make sure you know what you're getting, and if it has a potential for overdose, and also let them know, you might say, I have a couple of glasses of wine every night with dinner, and you might want to let your doctor know that because he might talk to you about the danger of mixing all those medications together. So before the late 1990s, the people most likely to overdose on prescription medications accidentally were people over 55 because they were getting the most amount of prescription drugs, and what they didn't realize, a lot of times they were mixing them with other things that were causing these accidental overdoses. It's really important to understand that you don't want to take them with other drugs. You don't want to take more than is prescribed. I actually have a friend of mine that I went to high school with. I actually grew up in the same neighborhood with him, and he was divorced and living alone, and he had knee surgery, and he overdosed accidentally on his prescription medication. They think that he was home alone and lost track of the time and took too many pills at once. But he literally accidentally overdosed on his medications. So it can and does happen. And as you get older, your body metabolizes all these medications slower. So it's less opioids, less benzodiazepines, and less alcohol mixed together could have a poor result. Keep a list of all your medications. I will say this, the pharmacies now usually have a list of all your medications, and most people use the same pharmacy, so they'll usually alert you to any interactions, but it's still good to talk to your doctor about that, to have that list, and to ask when you get a new medication, how will this affect my other medications? And talk about any alcohol use as well, especially with new medications. So I've talked a lot about an opioid addiction epidemic that probably might feel kind of far away for you, right? I don't know anybody affected by that, or maybe I've heard something, but it's not really part of my life, so what can I do? But the truth is, as I mentioned, when doctors were really prescribing a lot of these opioids, one of the reasons that we had so many kids getting their hands on them is because people were getting large quantities and keeping them in their house. And kids knew that, and they were taking them. So now they're prescribing less, but it's still important to remember that if you get an opioid prescription and you're not going to take it anymore, it's important for you to dispose of that properly. One, it's important to store it safely as well. So opioids are not, or benzodiazepines, those aren't the kind of pills you want to have lined up on your kitchen counter right there for everybody to see. Those are medications that you put away. We've had lots and lots of stories about home health aides, unfortunately contractors, and people's grandchildren, their grandchildren's friends, even neighbors. There was actually an incident in Worcester Housing Authority where a woman kept saying, my medication is disappearing, but I don't know who's taking it. I don't have grandkids. I don't know what's going on. They put a camera in her bathroom, and it was her friend. And this was an elderly woman who had become addicted to her opioid medication and then couldn't get it anymore and was stealing it. So people do steal medications, so those should be put away. When you're done with them and you have pills left over, you need to get rid of them. Fortunately, here in Uxbridge, at your local police station, you have a prescription drug take-back box right in the lobby. And you just walk in there, you throw the pills right in there, and then eventually when it's full, the police department will gather it up and they'll bring it, and those are incinerated. That's where they go. Nobody gets their hands on them. They don't go anywhere. They're completely destroyed. So what that means is none of those pills can end up in the wrong hands because they've come out of the supply. That is a really big issue because that is how so many, especially young people, start. So you have a prescription drug take-back box right here in your police lobby. Remember that they only take pills. They don't take liquid medications, and the police do not take sharps or used needles. And I'm not sure who takes the used needles here in Uxbridge, but the Board of Health can tell you that. They do. Okay, that's usually what it is. So you bring your sharps back there. I think the question was mercury thermometers. I think you can bring those either back to a pharmacy or you can bring those to your Board of Health as well, and they'll take those. They're trying to get mercury thermometers to make sure they don't land in landfills, so they're trying to get people to get rid of those and get the digital ones. So there is a mechanism for getting rid of all this, because sometimes people are like, what do I do with it? But the truth is, you don't want to flush that stuff down the toilet and put it in the water supply. You don't want to put it in your trash because somebody could get into it. Also, pets. We've had stories of pets that get into trash and then eat those pills. So if a human being could accidentally overdose on, say, 2 of those pills, imagine if a dog eats just one, right? A small dog. So the high potential of risk for pets as well. That's why you want to make sure you dispose of them properly so nobody else can get into them. You want to educate yourself on the signs and symptoms of drug use or misuse, just because in case there's somebody in your family or whatever, you want to be of assistance, get them help, but also you want to make sure that they're not actually using your medications. We do see a lot of family members who take medication from other family members. Never share those. That's the other thing. Don't share those medications. Somebody says, this is something that used to happen a lot too. Because somebody would have a prescription for opioids and somebody else would have a sore shoulder or a knee, and they'd say, oh, take these pills. My doctor gives them to me. They're great. You don't want to share those. Again, you don't know what other medications people are taking. So your medication is your medication, and if people need medication, they need to see their doctor to get prescribed medication. So this is a big statistic. This is my last slide, and this is why, for those of us who are not misusing these prescriptions but have access to them, it's important to remember this, that 69% of opioid drug users, and by that I mean people that misuse them, that became addicted, say they got their first drugs, prescription drugs, from friends and family members. So 70% of people that eventually become addicted to opioids originally got those pills for free and got them from either friends or family members. So the friend stole them probably from a family member. That's almost 70% of the people that end up addicted. So if none of those pills had existed in grandma's house or mom's house or an aunt's house or an uncle's house, so a lot of those people may never have become addicted. So that's why it's so important that we all do our part, especially with the safe disposal of these medications and the safe storage of them. Does that make sense? Does anybody have a question? Sure.
I have a question. Well, not really a question, but I never realized how important even one pill was.
Sure. That's a good statement.
Yeah, because like I'm on TV, and she called me, she said, it's 1 milligram of pills. And I said, well, it's only 1 pill. She says, oh, no.
Right. So, and that's important. So this lady brought up the fact that one pill is very important, right? Because the dosage. Right. One pill can make a difference. And, you know, that's the whole thing with all prescriptions, is that they're not all the same. So 10 milligrams of one drug is not like 10 milligrams of another. You might take one drug and you might need 1 milligram of it. You might take another drug and you need 300 milligrams of it. So don't just assume it's no big deal because it's one pill. And truthfully, the DA always says, and I think the governor said it originally too, like one pill with these opioids can be a game changer. Because sometimes kids take one of these pills and they love that feeling. And they take that. Are they physically addicted yet? No. But in their head, they're already looking. They already want that pill again. And so one pill can really be a game changer. And that might be all it takes to get somebody off and running.
Times, like you said, some pills come in 1 milligram, some come
Right.
in 2 milligrams.
And you might think, so you might have had a prescription that was similar before, and you say, oh, I took a much stronger one of those before. I can take 2 of these. Always take as prescribed. And if you think you need a different dosage, call your doctor first. Discuss that with them so that they understand what you're saying and you know whether or not you should take more than that. That's really important. Thank you. Any other questions? I have lots of handouts. So the other thing is I did bring some information on scams and frauds just because I don't think we can repeat that message too much. So there's a bunch of stuff back there on scams and frauds as well. So please help yourself to all of those. I don't know, Chief, if you want to add anything. Oh, thank you very much. Well, thank you very much for having me and listening to me during your lunch. And I'll be here just kind of breaking things down. If you have some more questions, feel free to ask me or come up. I'll be happy to answer them. Thank you.